All right, crew. Dr. Sil here, junior doctor from Australia on the psychiatry training program. I'm going to start trying some of these types of videos. What do you call them? Essentially, just driving and reflecting on the day. So yeah, I've just finished the day at work and there were some interesting reflections to share. I try and keep it on theme, keep it on a topic. And today I thought I would talk about tact. Tact. You guys have heard of the word. It's a good word. Definitely a word I've been using more recently, given that it's something I need to work on. Very keen to hear you guys' reflections on your experience with different mental health clinicians or physicians, or different mental health doctors, and whether they have tact. And so make sure you guys put some comments down below. Look, what is tact? I think tact is the ability to communicate information in a way that is sensitive and efficient. That feels right. This is just coming from my brain. I'm not quoting a definition. Sensitive and efficient. Yeah. What does it mean to you guys? I think that sounds right. I think I agree with that definition. And I think it's one of the things that's very hard to learn from a textbook and is definitely experience-based. So someone with more experience, more exposure to difficult conversations develops better tact. And I think as a junior registrar, I've got a bit to learn. I'm proud of how good I am at having difficult conversations with patients who are unwell, sometimes giving them bad news, often giving them bad news, and managing conflict and trying to maintain positive rapport so that we can continue to work together. But sometimes I'm maybe too direct, too adversarial when I could be a little bit softer, too rigid when I could be a bit nicer. I don't know, something to work on. But anyway, my experience is that is kind of in my report writing, my note writing. So as you know, we all have to write reports. After we see a patient, you got to write a note. You got to describe what you guys talked about, what the person looked like, what their mental state was, and also your impression of what's happening. And I guess, without disclosing any identifying features, I was seeing a patient and my impression was different to that of of someone else who was seeing them. And yeah, I guess you got to, first of all, what do I know? I'm seeing this patient cross-sectionally. So I think, although I was right to reflect on my impression, I should have used language that suggested that this impression is formed off of, a single interaction and my review of the files. And I received that feedback, and it's important to acknowledge that we're all imperfect and we're all just doing our best, and I'm gonna try and do better next time with more tactful words, with more tact, trying to maybe say, instead of I think this is the case, I could say, well, cross-sectionally, this is what was suggested by these observations. It's maybe being a little bit softer and less absolute in my language. So that was my kind of learning from today. And I actually got positive feedback on receiving my negative feedback, which is funny, kind of, that's a very nice way to give feedback. I felt really good at the end of that feedback session because the person was like, look, you've done a really good job at receiving this feedback. You're clearly very open to improving and yada, yada, yada. And I was like, oh yeah, that's great. And that's a really nice thing to hear. So another learning for me is if I'm giving feedback to someone, I should try and close it off with a positive reflection on their abilities or if they're receiving the feedback well, on their ability to receive feedback well. So I guess my issue with tact here was really in my documentation area. And I think I do better in my interpersonal patient rapport and interviewing area. I think I have pretty good tact with patients. And And I'd be keen to hear your reflections on what makes, a psychiatrist or a mental health professional have, what helps you develop a good rapport with them. Or if you're a clinician, what do you do to help develop a good rapport with patients? I think what I've been finding helpful is really instead of just using the list of questions that you have to ask as when you do a review, you have to ask a list of questions in a review. We have to make sure we ask about drugs and alcohol and suicidality and, supports and stresses. But instead of asking this in a kind of checklist, almost abstract or robotic way that's almost apathetic, it's not really a connected, caring thing. I try and ask it in a narrative. I try and understand the person's narrative, their story, how'd they get to the hospital admission, how they've been in the hospital admission. And along the way, picking up and making sure I'm hitting all the points of the checklist. So I actually bring the checklist in to my reviews, the things I've got to ask about, because I'm very forgetful. If I don't bring that in, I'll totally forget to ask about this or that. But I don't focus on asking in that order. And I focus on just getting the person's story out, just get them talking. And then through them talking, you'll see what the main issues on their mind is. It's very important to try and get it in a bit of a storyline. And then towards the end of the review, I might make a point to say, all right, look, we're running out of time. Let's just, before we wrap up, I just want to ask you a couple more yes or no questions. And then you can just rapid fire. Alcohol, how much? Smoking, how much? Yada, yada, yada. And you can be pretty efficient that way. But that's also, it's more helpful to do it that way in terms of forming a rapport, because the patients generally feel you really care because you're forming their narrative in your mind and they can sense that you're like trying to understand their story. So another interesting thing to reflect on in the comments might be, what's the thing that a clinician has done for you that has most helped build rapport and most destroyed it? So have you ever had a psychiatrist fall asleep during your review? And also have you ever had the experience of a psychiatrist saving a bad situation? So I'm reading Irvin Yalom, who's this incredible psychotherapist who's completely he's just very fundamentally affecting how I am as a psychiatry registrar. Just really good insights, beautifully reflective, psychodynamic, and existential, and very, very nice to read. And the audiobooks are great. So I'm just reading Love's Executioner for the second time, and it's funny when you read things a second time. Like, I felt the first time I read it when I was a medical student didn't really do much for me, but I'm reading it now at the right time, and there's a lot to be said for reading the right thing at the right time. Anyway, that's what I'm reading at the moment, and he's talking about I'm reading two of his books. This is in his second book that I'm reading, which is on the matter of death and life, which is very moving. But he's talking about how he started a review with a patient really badly. He totally forgot that they were coming. They were super offended, and were tearing up because he couldn't remember who they were or why they were there. They felt vulnerable, exposed, and he was being forgetful because of his cognitive decline in his old age. And I was just thinking, how are you going to save that so that you can build any rapport? That's a very painful thing for a patient, to have been forgotten. And he just did such a lovely job to be like, look, before we start, I want to say three things. First of all, I'm so sorry this has happened. It is not a reflection on you. It's a reflection of me and my memory and the fact that I've got a lot on in my life. At the time, his wife was very unwell. And he said how he's not going to charge her for the appointment because of the distress that he's caused, which is just, a very human, it's a human and kind thing to do. And I always, when I think about what I should do in any situation with a patient, I always say to myself, be kind, but firm. And hopefully that guides me in the right direction. It definitely guides me in how I speak to them. I'm always kind, but firm. I've had patients say, oh, you're really grumpy today, Dr. Sill. And I said, I'm not being grumpy, I'm being firm. And we all laugh at that. No, it's just important sometimes to hold your ground. You make the plan. When you trade stocks, there's an expression where you plan the trade and then you trade the plan, because when you're trading the stocks, if they're plummeting down, you got to hold your ground. Trade the plan, and I think that's the same with a lot of mental health reviews. Anyway, I'm being tangential, and I was talking about Irvin Yalom and how human he was and how kind he was, and I think after that, the patient was able to reconnect with him when he made those that kind point. So I think a key thing is, if you've lost the rapport in an interview, and I'm not good at this yet, but it's something I'm working on, call it out. Say, look, I feel like there's a distance between us. I feel like I've upset you. I feel like something I said has destabilized. Whatever it is, call it out with, in a nice way, and then explore it honestly and in a human kind way. And I think if we're going to talk more about rapport, there's a lot that can be done to form good rapport. And something I was doing, I didn't even realize it had a name, but I heard it's called the psychiatric grunt. I hope it doesn't cheapen it, because it is a genuine thing to help promote someone to talk more. And you guys do it too. Everyone does it naturally. If they don't have a social interpersonal issue in their mental health, but it's a very natural thing that if you're talking to someone and you're being quiet and they're talking, but you want them to keep talking, you will nod and you'll go, all right, It's called the psychiatric grunt, which is like essentially the tell me more without saying tell me more, so that you don't interrupt them. And I definitely do that. I nod. I have a tilt to my head. My body language is genuinely like engaged and interested, and so I think that's important in forming a rapport, because I've seen, some junior doctors and psychiatrists have just really disconnected body language, and trying to think of a way to describe it without identifying anyone, but making sure that what you're doing is engaging with the person, and not with a label or a diagnosis or an artificial thing. This is the person in front of you, the same way it's someone's mom, it's someone's daughter, it's someone's dad, it's someone's brother. Try and humanize people as much as possible. So I found that to be a very important thing to do. But that makes work more exhausting, I've noticed. Like, if you don't care too much about patients, or if you do just genetically or for whatever reason find that you have less empathy, it does just take up less emotional energy because you're not as attached and you don't get hit as hard when bad things happen. And bad things happen a lot in this realm of work. So it's almost, there are disadvantages to caring too much. And I'm sure that if you were to do a study, okay, I shouldn't say I'm sure, because, I don't want to be too sure, but I would suspect that if you did a study looking at levels of conscientiousness and burnout, that the more conscientious a person is, the more they care about other people, the higher the levels of burnout, because the amount of emotional energy that not only do they get exhausted with by using it up in their reviews, but also the disappointment they must get when other people don't meet their expectations of care. Which is so sad, because the conscientious, super empathetic people are so important in psychiatry. So what's the solution to that one? I don't know. And, with all kind of jobs, it's about getting a balance of different individuals with different skill sets for the different problems to solve. So someone in forensic psychiatry who's dealing with chronic treatment-resistant schizophrenia with very high-risk population might not need to have the same level of, empathy as someone who's doing, childhood and adolescent psychiatry. So there is room for different, I guess, levels of empathy. But at the end of the day, the person in front of you is a human having a human experience. So you do have to have some. I think I have a pretty good balance at the moment. Like, I don't feel too burnt out. I do care about the people that I'm caring for. But I also recognize that the world is just pretty rough, and some people just have it bad, and we can only do so much to help them. There are just some people that I can't do that much to help. So I do have a balance between really caring about people and acknowledging that there's only so much I can do. And that's been very helpful. And, I think that's an important balance to achieve. Anyway, that's my reflection. I'm not going to edit this video too much. I kind of just want to make these videos a bit easily and not have too much. The more edited a video is and the more effort you put into it, the more resistance that builds, conscious and unconscious, to making the video. So if some people just enjoy watching this, then that's great. Just me ranting and reflecting. I find it super helpful to talk out loud. Because when you speak out loud or when you journal, it forces you to reflect linearly in one line and stops you from getting these, unhealthy patterns and circular thinking and things like that could be really unhelpful and cause ruminations and anxiety. Oh, that's one we should talk about next time, is anxiety. Yeah, we can just have these rants into do a different topic every day. Today will be rapport and what would you call it? Rapport and tact. That'll be the title of today's video. Yeah, leave comments down below if you kind of enjoy this kind of content. It's super fun and easy to make, so I'll probably keep doing it even if no one wants to watch it. It's inspired by Sam Sulek, who I don't know what I've got in common with him. He's a massive, ripped bodybuilder, but he just makes simple videos like this, and he has an incredible following and they're not heavily edited, and there's no thumbnail work. It's just him chatting. The thumbnails are pretty good, actually. I think I should say that. But in terms of the video, it's just him chatting with minimal editing, and he's got millions and millions of subscribers. So that's the goal. Yeah. All right, cool, guys. That's it for this video. I'm going to love you and leave you and wish you all a beautiful day full of love and connection. And I'll see you guys all in the next video. All right, bye for now.